And if there are any outbreaks or anything, we're here to advise and to help the best way we can. We have new guidance from the CDC about when to come out of isolation. They had originally recommended that folks have a negative test before they return to work or society, and they're not recommending that now, maybe due to the shortage of tests. I think we still are scrambling to get some tests, but now the recommendation is at least 10 days have passed since symptom onset, and at least 24 hours have passed since resolution of fever without using fever-reducing medications, and also to be sure that other symptoms have improved. We have received some funding that's going to help us expand testing, but I don't have any specific details on that at this point. It's very loose on what we could use it for, so it could be testing events, it could be providing testing equipment and PPE. There's a lot of different ways that we can use that money, so stay tuned for that.
Okay. Nancy, I have a quick question for you before we move on to someone else. So yesterday the governor had his briefing, and he was talking about the COVID-Wise app for your phone. Is there anything you can tell us about that?
I will tell you something about that. I was in the beta group and have had it on my phone for a month or so. This app is non-intrusive. It does not follow you. It does not tag you. What it does is it works on Bluetooth so that your privacy is secure, and it basically, you self-report if you're positive. It doesn't know who you are. It just gives you a PIN number, and you can see who's positive around you, and that way you can avoid hotspots. I think the governor said this is the first app in the United States by a state that's using this kind of technology. So I'm encouraging people to sign up for it and give it a try. You can take it off your phone if you want to, but the privacy concerns have been taken care of. So I feel confident that it's just another tool we can use to track and treat the virus.
Okay, so just if you've been close to someone that has posted that they had tested positive, does it alert you, or
Yes.
you just basically, okay, it does. Okay.
If you're considered a close contact, you'll get an alert. If you are just a casual contact that you may have been exposed, then you can just look on this map and see. It has a map of dots around you where you are.
Okay.
So you can see, if you want to go into TJ Maxx, maybe you don't want to go into TJ Maxx. If someone reported they feel like they got sick there.
Okay. Thank you very much. I'll tell you, Jackie, we'll go on. We'll keep the healthcare, we'll have that going first, and then we'll move on to Leon and Tim. So Jackie, what do you have to tell us this week from SOVA?
Yeah, so I'm the Chief Nursing Officer. I am kind of responsible for the clinical nursing in our health system. Dale usually does this, so he was unable to join, and I kind of wanted to give you an update of what we're seeing. We do keep an update. He may have mentioned this out on our website, but I'll go ahead and give you an update. Currently, we have about 40. We're treating about 40 patients that have tested positive across both campuses. I just recently, right before this call, got off a call between the two campuses, and it's pretty equal across both campuses in Martinsville and Danville. We are split. It's the same number between both campuses, so it's not one over the other at this time. But right now we're adequately still able to meet the patient needs and have the capacity to continue seeing our patients in the intensive care units. We have some in our intensive care units and some on our medical surgical units. So some still are more sicker than others. We did have a change in our visitation policy at the Martinsville campus because we have seen a rise in the number in Henry County and the city of Martinsville with the positives in our community. We decided to go ahead and go back to restricting visitation in the inpatient units to protect our visitors and our patients that are not COVID positive. So that went into effect Friday. We do have that also, that link we have. If you go to our website up at the top, it'll have COVID-19 latest updates, and you can click on that. It's got our policy and any updates if that policy changes. Danville has been on that restriction about 2 weeks now, and we just updated ours last Friday. We do make exceptions at times. There's those, exceptions for end of life, if we can at all make those types of exceptions, of course, or laboring patients if we can at all possible. So we do look at those types of circumstances if we can at all. You can go to that website or call us if you need to have any additional information. I do want to reiterate, sometimes we've seen patients delay in coming to the hospital that have other needs and delay coming because they feel like that it's unsafe to come. And we have taken a lot of precautions and put processes in place to separate the COVID population to the non-COVID. So when you come into the ED, we separate that patient population, and it's safe to come. If you have a need and need to come to the emergency room, we don't want you to put it off if you have a need for you or your family. Because we have seen patients at both campuses put things off. I'm having chest pain. Should I go? I don't know. Let me put that off a little bit longer. And they may be having a heart attack or a stroke, and we don't want that to happen and it be worse. So we do want to ensure that if you have a need, we have made it safe for those patients to be seen. And so we do continue to need the community support out there. The best, I think Nancy would agree, the best sort of still precautions for the community is wash your hands, the mask, and social distancing. As I heard Tim say, there's still a lot of unknowns. I think we still learn every day with this disease, but we do know how it is spread, and wearing a mask, washing your hands is the best thing. But we have taken precautions if you need us for anything.
Thank you, Jackie. And I was going to ask you or Kelly if you would reiterate about it is safe to come into the hospital. So I'm glad you did touch on that. I heard someone last week say, I can't go, and I said, yes, you can. I said, right now, the hospital's always clean, but they are on, high alert right now. If you don't feel well, go. So thank you for, sharing that again and making sure that, our community knows that it is safe to go if they have other issues too.
Absolutely. We don't want you to put that off. We put a face mask on the patient. We separate them. If you have any signs and symptoms, we're looking at from the moment you step in the door. We don't have patients lingering in the waiting room. So we make sure, and we want those patients to come if they're needing. Don't ignore those signs and symptoms.
Thank you so much. And
also,
Tim?
can I add one thing?
Yes, sure.
And it's not just for hospital care and emergency care. Please reach out to your physician offices. If you have diabetes or high blood pressures, don't miss those routine checkups that you need to be having. Physician offices are taking the same precautions as we are at the hospital. So please keep up with your routine appointments as well.
Thank you, Kelly, for adding that. Tim, if you'd like to give us an update from the county.
All right. Thank you, Sharon. And thanks, everybody, for being on, allowing me to be on. A few things I want to get out today. One, first thing, to talk about our small business grant program. As you may recall from previous calls, county allocated $250,000 for small business grants for businesses located in Henry County. We've set a deadline for that now of August the 31st. Small business applicants must apply by August the 31st for us to consider that. We've gone through roughly about half of the money that we've allocated so far, and I think we're up to about 80 to 82 applicants, if I saw the most recent number this morning. Some of those we're still going through, and we'll add to that money, or add to that dispersal amount that we're talking about. But it's a great program. If you can answer just a few simple questions and meet some simple benchmarks, we're happy to disperse that money to small businesses that are located within Henry County. But the deadline is August the 31st to get in on that. And the entire application process is on our webpage. Folks can access that if they're unfamiliar with it. Number two, sometimes gets lost in the shuffle. This is a census year, and both city and county require on accurate and robust numbers of census participants because we access a lot of federal grant money based on population. So we need as many people as possible to go online, fill out the census form. I did see this morning that the Census Bureau is going to stop its public outreach. In other words, it's door-to-door outreach. They're stopping that a couple of months early. They're stopping it on September the 30th. My concern, and I would say Leon probably shares this concern, is that if we get undercounted through whatever reason why, whether people just don't participate or the deadline sneaks up on people, that could literally cost us hundreds of thousands of dollars in school funds and CDBG funds and HUD funds and that sort of thing. So it's very important that people participate in the census count and help us get the best, most accurate count that we can get, because that has a true impact on funding that we could access over the next 10 years for our schools and other entities and other items. So please, we encourage folks to participate in that. Finally, number three that I want to get to, the Public Service Authority, like most utilities in the Commonwealth, we have a moratorium on disconnecting past due accounts. We are not under the auspices of the State Corporation Commission, but we are following its guidelines as to not cutting off service. They have set a deadline of August the 31st to reconsider that and perhaps do away with that barrier. So the PSA will look to do the same thing. So on or around August 31st, unless it gets extended by the FCC, we will go back to addressing delinquent accounts. And then we made a mistake earlier this week, and we're going to cop to that. In our most recent billing to PSA accounts, we had intended to send out a notice to those with past due amounts and remind them that they're past due and urge them to contact the Department of Social Services, because the county has given $200,000 to social services for citizens to pay past due utility accounts. Unfortunately, our vendor, our third-party vendor who prints our bills, put that notice into every one of our bills, not just to the ones that are past due. So as you can imagine, that's a bad mistake. And we've been dealing with that through phone calls this week and trying to let people know that if you're not past due, you're not past due, no matter what that little thing says in your bill. But it does encourage people, perhaps this is an unintended consequence, but it has generated some interest in, well, how do I find out if I am past due? And for the last a little while, but it's good to let folks know about it again, you can go on our website and type in your account number and your citizen ID number or your customer ID number. Both of those are found on your PSA bill. You can go online, type in those two numbers, pull up your own bill and see what your bill status is. So that's the website is henrycountyva.gov/public service authority. And if you have your bill with you, you'll need to type in those two numbers, but that shows you up to the minute what your bill looks like. Sending that notice out is our mistake. We can't fix it, but we're trying to mitigate it. But at the end of the day, if you are past due on your bill, we highly encourage you to contact social services. They have a pot of money there that's just waiting to be spent. And if you contact them, tell them you're past due, show them evidence of that with your bill, they will write a check directly to the utility. And this is not just for Public Service Authority accounts. If you're arrears on your AEP account, for instance, you can tap this money and do the same thing. So unintended consequence to raise some blood pressure of people who know they're not past due, but it said you were. But perhaps it also makes people realize that if you are past due, there's a way to get that paid, and just try to work through that process at social services. So our mistake, our fault, but at the end of the day, maybe it generates some interest, and people will go to social services and get the money that they can get to pay those bills. And I'll close with this, echoes what everybody else says, but 3 things: wear your mask, wash your hands, socially distant. That's the only way we're going to get back to what we want to get back to. So that's all I have. Thanks, Sharon.
Thank you, Tim. Leon, if you'd like to update us on the city.
Sure. A lot of what I have to report on is similar to Tim. I would add to his 3 things there that somebody reminded me of a 4th item about, washing your hands, and that's to keep your hands away from your face. And I guess if you're not aware of it, you'd be surprised how often people will, go somewhere, go down the hall and touch doorknobs, and then come back and all of a sudden you're scratching your face or rubbing your eyes or something. And it's a bad habit. I'm trying to break it, but I would certainly encourage others to think about that. But similarly, as the county, probably the big issue for us is the CARES funding, the money that we got from the state. We received a pot of money, or were advised in May that we were getting a pot of money, and our initial distribution was 1.1 million. Lo and behold, about a week ago, we got another note from the state that we're getting another 1.1 million, so that we're getting another pot of that money. We, as the county, early on set up a small business grant program to help small businesses that incurred costs, or in some cases had to shut down during the pandemic. We began ours a little earlier than the county, but we had $5,000 grants we were giving away. We cut ours off at the end of July, and we're still kind of cleaning up some of those applications because we got a flood of them in the last week or 2 of July. But so far, we've reviewed around 140 applications. And when we first started off, we decided we were going to set a pot of about $250,000. As of our meeting this past Tuesday, we've gone through $405,000 worth of small business grants to about 140 applicants. We're cleaning a lot of these up. There were quite a few of those that we needed additional information, and we'll be meeting next week to decide if we're going to go through another round and extend this to maybe another month or 2 months. We still haven't decided that. Probably will. There may be some different conditions that we attach to the next round of grants, but pretty successful. We're certainly glad to get that money in the hands of small businesses, and based on what we saw in the applications, a lot of them really need it. To kind of piggyback off of something that Tim said about census, the CARES money that we're getting and the county's getting and every locality in Virginia's getting is based on population. Those distributions were made to communities throughout the state based on population numbers. So again, that's another reason to beat the drum about an accurate census count, because if you don't report your numbers, you don't get the money. So that's another important reason to pay attention to that. Kind of back to some of our stuff. Right after Virginia went to phase 3, one of the things that we did is we began issuing special event permits, and that's where somebody wants to hold an event at the city park or on a public street. There's a permitting process that you go through with the city, where we review it with police and fire and the health department and everybody involved, and then generally issue what we refer to as a special event permit that allows that to occur. And as I mentioned, right after Virginia went to phase 3, we opened that up and began issuing those permits. And we quickly realized that was a mistake and had to walk that back pretty fast. We had a couple of events, and it turned out that with a lot of these, there is simply no way to control public access. So we had events that I think were anticipated to be small events. They ended up being huge events with people coming in from all over the place. So once we had 1 or 2 of those things occur, we realized that we had made a mistake. So we've since corrected that, and at least for the foreseeable future, we're not issuing permits for special events. We may resume that at some point later this year, or it may even go into next year. We're kind of playing it month at a time to see how conditions occur. But as of right now, we're not issuing any permits for special events. On the utility accounts, again, very similar to what Tim said, we are suspending disconnects through the end of August. And as Tim mentioned, we aren't obligated to follow what the State Corporation Commission does, although we kind of watch that to see what other utilities and localities are doing. And generally, we'll try to parallel that. As things stand right now, unless something changes, we will begin utility disconnects after the end of August. We have a long list of customers who have not paid utilities since probably March. In all likelihood, we will be distributing some money, social services, maybe Grace Network, to help those customers who are probably not going to be able to catch up on their bills. So we're looking at that as well. I haven't quite decided how to go about that yet, but we will be doing that probably in the next several weeks. And I guess kind of follow up with one last thing. In spite of what folks hear or read in the media, we do work well with the county. There are several joint projects that we funded with the county using our CARES money. There was some work that was done at the 911 center with some safety equipment and additional computer equipment. I think we just agreed recently to help with social services with some similar types of projects, and also with the sports complex. And both the city and the county are pitching in on those projects and using some of their CARES funding to jointly help with those projects. So there is some good things going on in the community. And I will end with that.
Thank you, Leon. And I guess I'm going to open it up for questions now. So Luis with BTW, I will start with you. Do you have questions for anyone?
Yes. Can you guys hear me?
Yes, sir.
All right. So my first question is to Nancy Bell. Could you tell us, I know we have obviously been seeing the increase in cases in the West Piedmont Health District. Could you say why we've seen a lot more hospitalizations?
Well, we have had outbreaks in long-term care facilities, and folks who are in long-term care facilities tend to be more frail and immune compromised. That's why they're in there in the first place. So you have a much more susceptible population getting sick, and that would be my thoughts on why that's happened.
And media-wise, it's a bit difficult to get some information about those outbreaks. Have those facilities been cooperating with you all?
Yes and no. Some were very cooperative up front, and one was not. And we have been on that one, and things are getting a whole lot better.
And have you guys been getting reports of not wearing masks and things of that nature, or have you guys mostly been focusing on contact tracing at this point? Because I know that's a big task that you guys have.
We have been getting a lot of reports. The folks have called the health department directly, but we're referring everyone to the VDH website. There's actually a reporting form on there, and it makes it sort of official, and then we get a report. We have had to take action against several businesses, mostly retail, and one restaurant in particular had multiple complaints about weekend crowding and that sort of thing, and the owner of that restaurant is working with us very strongly. Yes.
We have seen that, if you go to the stores, grocery stores or retail stores, that people are wearing a lot more masks. What would you say has helped with that?
Hopefully what we say on here every time we meet, the 3 things we need to do. The 4th thing, as Leon said, washing your hands, but also I think people are starting to pay attention to the numbers. And the numbers don't lie. For every positive person that we identify, there are certainly more out there that we haven't identified. And we're certainly not trying to scare anyone, but it's such a simple thing to request, so the wearing of the mask out in public, that we're just keep hammering that home.
My last question for you is going to be, you touched on it a little bit. The numbers are real. One of the biggest things that whenever we do something like this is the biggest thing is, fake news or the numbers
Right.
are fudged to get some funding for something. Can you attest to that your numbers are real?
Our numbers are real because of the process they go through. Every positive case is sent to the CDC, who then filters those down to the states and the health districts. That's why there's a 1 day lag. And that's for the purpose of double checking and routing it appropriately. So every positive test gets routed through the CDC by the physician or whoever conducted the test.
Thank you. And then my next question and last one is going to be for Leon. I know that you touched on those individuals that have money that they have not paid for utilities since March will not be able to catch up. Oh, is that going to be, is there going to be a total amount that they owe and going to be chopping it off a little bit month after month, or how would that process work?
Well, what we're trying to do is set up a utility payment plan with those customers who are delinquent. And typically for us, they always at least have to pay their current bill. And then any delinquent amount, we will just simply, if we go with a 6-month plan or a 9-month plan, we just simply take that delinquent amount and divide it incrementally into 6 or 9 equal payments. And then in addition to keeping their current monthly bill, the monthly bill current, they would pay 1/9 or 1/6 or whatever that time frame is of that delinquent amount. So we'll be working with customers to try to come up with some reasonable plan where they can get caught up.
All right. Thank you all very much for your time.
Okay, thank you, Luis. Ron,
Yes.
do you have questions for anyone?
Yes, I'll take Nancy, Jackie for 500, please.
Okay.
For both of them, when I walk in every day and look at the report and report the news, it's getting to be irritating to keep reporting these numbers every day and going up. With that being said, what toll is that taking on the health department and SOBA?
Well, I'll start from the health department perspective, and I'm really glad you asked. Our people are exhausted, and it's coming time for school immunizations and flu shots, and we're going to have to pull our people back onto their regular duties. And even though we were able to hire some contact tracers, et cetera, we had a staff meeting yesterday, and people are not going on vacation. They're not seeing their families. They're working all kinds of crazy hours. They're worried about their own safety. When you're exhausted, you're more likely to get sick. So I don't know what the answer is to that, Ron, except that we hope that we are doing right by our communities. We are certainly giving it our best try, and pray for our people because they're really, really, really working hard at this.
Jackie?
Yeah, you broke up a little bit, but I think I'm hearing you ask about the resiliency of our staff, and because this has been going on now for several months, and we're getting higher cases, not lower cases, and so we do. They are getting tired, but we are bringing in additional staff from other states also to help preparing even for the fall, anticipating the flu season so that we can be prepared for an influx even weeks and months to come, so that we can continue to give relief to our staff and also be prepared for even more cases if needed. But they're working very hard. We're supporting them to give them the time if they need a couple of days, here and there, and giving some days off to give them some time off to rest and to continue to support them. But as Nancy said, prayers are always appreciated too, because they are it is a journey, but they are very resilient, and they are very hard workers and care about the community. And so, but they're hanging in there. But that's what we're doing. We're doing a lot of cross training of different departments to help out in different areas, to support each other as a team, and but bringing in other staff and labor from other states.
And if I could ask both of you, with the flu season right around the corner, what is the biggest concern with the health department and with SOVA?
Of the health department and probably SOVA as well, our biggest concern is there's so many people and not enough to tackle both of these. We will continue to offer our flu pods. We have already trained for that, and we've already ordered our vaccines for this year. I mean, it's something we have to do. Even if we weren't mandated, we would want to do that. Can you imagine having the flu and being compromised or in an area where there's so much COVID? It could be catastrophic. So we're just going to keep putting the rubber to the road and hope we don't wear out the tire before we get on the other side.
Yeah, and I would echo what Nancy is saying. The same thing. We're already preparing for flu season with getting our vaccinations in for our clinics and for our healthcare workers to protect them, and starting our dates and getting those scheduled for our healthcare workers to protect them, and for our clinics to be preparing to immunize our patients in our clinics.
Okay. Hey, thank you. And this is for Leon, getting to the census that Tim was mentioning. 10 years ago, when the city had the census done, I think, correct me if I'm wrong, over 40% did not respond. What has the city done this far to address that issue?
Well, we've certainly put more emphasis on it. Unfortunately, I can't say with a lot of excitement that the numbers are bearing out much improvement over that. We've had a lot of emphasis on communication, trying to get the word out to people. You know, early on, we'd intended to have some community meetings, neighborhood meetings. Unfortunately, the COVID issues kind of took care of some of that, and it restricted what we could do. But we're doing an information push. We're trying to get information in our bills out to our citizens. We're utilizing MGTV as much as we can. We're doing some public service type announcements. So we're using all those avenues to try to get information out. And again, unfortunately, I'm not sure the numbers are bearing out a lot more success than we saw 10 years ago, but it's not, certainly not for lack of effort. And we'll continue to do that right up until the very end.
All right. Thanks. That's all I have. And thanks again for having me on.
Thank you very much, Ron, for joining us. And Bill, do you have questions for anyone?
Unmute. Hello.
Hello. Okay.
Okay. SOVA Health. I've got on my left Jackie. I think, is that correct?
Yes.
Yes,
Jackie
sir.
Wilkerson.
Jackie Wilkerson. Okay. And then on the right, I'm sorry, but I don't think I know you.
I'm Kelly Fitzgerald. I'm the Marketing and Communications Director.
I do know you. Okay.
Yes.
I don't think I've seen you before. Okay,
Yeah.
Kelly. Thank you. I just I had comments from both of you. I wanted to make sure I got your names correct. Nancy, question for you. With the Virginia Department of Health numbers, I think that came out today, showed another death in Henry County, and apparently somebody who died in Martinsville came back to life. I mean, where are we with that? Do you, there wasn't any explanation given. Do you know what, was it just a statistical error or what?
It was a statistical error. We have checks and balances, and sometimes it makes us look bad, but we want to be accurate. So we'll move a number to the right column if we need to.
Okay. Was there any particular reason for discontinuing the daily numbers as you were doing before? Because we're actually getting bigger numbers now than we were when you were doing them.
Well, we have more cases now than we did then, but it's a matter of somebody who's very busy has to make a report for me so I can report those to you. And right now, at the beginning, we had one person managing all the cases, and then we had one contact tracer. Now we have 4 people managing the cases, and I'm not even sure how many contact tracers. So we can't get everybody to rally in with their numbers to create a report at the end of the day like we used to could. It's just, you know, the same thing we keep saying, we're just overwhelmed.
Sure. It was interesting that you noted that you had begun enforcing some of the rules, and you had indicated, I think the last meeting that we had, that you didn't have the teeth or the, I forget the expression, it was a good expression, to do it. Do you now have that? I mean, what's changed?
We called our cousin Guido, and I'm just kidding. And it's not a laughing matter, but we have partnered with Virginia ABC and some other entities, and we might make a recommendation together that gets folks' attention. Let's leave it at that.
Okay, thanks. Tim, Leon had said that the state apparently doubled down with the city, and the city's gotten twice its CARES money. Has that happened in Henry County? And, or if not, do you anticipate that it will?
We've gotten, yeah, it has happened, Bill. We've got notification that we're going to double down, as you say, and get another $4.4 million. And the rules are the same, which means we really don't know how we can spend it, because the rules are basically, you know, if you think it's COVID related, spend it. And if we find out it's not, boy, are you in trouble. In fact, we had a meeting this morning with our finance director and with our deputy county administrator to go through how to allocate some of that new money that's coming. We had to fill out a pretty involved survey on how we've spent money so far, how we anticipate spending it in the next quarter and then the final quarter of the year. And we completed that this morning and submitted it. So we anticipate getting that money next week. We will look at how to spend it. And we want to do, you know, if we have to reinstitute the small business grant thing, if we exhaust that money, then that's something that we could go back and do again. And there's some other things that we can look at, but we're working through all that. It sounds like a first world problem, trying to figure out how to spend that much money before December 30th. But, you know, we don't want to spend it haphazardly, but we want to spend it as well and as widespread as we can to help the most people. And that's a process that we're trying to work through. Again, you know, we may slide more money to the utility payment approach if we need to do that. So that does give us a little bit of breathing room on how we can approach it from here on out. But yeah, to answer your question, we are getting basically a second scoop of ice cream, if you will, and we're addressing on how to get that out.
Great. Okay. Thank you.
Thanks, Bill. And Charles, do you have questions?
Sure. Let me start with Nancy. Last time we spoke, you said that we weren't winning the war; the virus was winning. Do you still believe that? Because Henry County numbers seem to be the largest around the region.
I still believe that for the district. Patrick County and Henry County are really experiencing more average daily numbers, and I expect that they will continue to do so for at least 3 or 4 days. So yes, as long as we are having to live in quarantine and adjust the way children go to school and not be able to pay our bills, the virus is definitely still winning.
Right. This came from a viewer. They were asking how they could become contract tracers. Is that something that folks can sign up for?
As of today, the West Piedmont Health District has hired all of them that we can hire with our allocation, but I'm not sure about surrounding counties, and I would assume that we would be opening those back up again. So people who are interested, I would go ahead and go on the website and choose any of those recruiter agencies and put my information in, because we may be moving some of our tracers up a level to case investigators and managers, so we may have openings again.
I got you. Is that website, can you give me the address to that?
It's just VDH, it's just virginia.vdh.gov, and then you go to the coronavirus tab.
Okay, all right. Next question's for Leon and Tim. I know you guys work on budgets and things of that nature. How long do y'all foresee this COVID thing affecting us? I mean, I know it's very difficult to tell, but as you're looking at you, obviously to the end of the year and then past, you think?
I'll take a stab at it. I think we're going to see the effect of it at least through this budget year. As we were doing our budget last year, of course, all this stuff happened in the spring. We were kind of toward the end of our fiscal year. As we had prepared our budget for the year we're in now, we had to make certain projections. So I think now where we are is kind of a wait and see approach to see what actually happened as FY20 finished, as the last fiscal year finished, and whether the projections that we made going into FY21 actually were accurate. My guess is probably around September, we're going to end up making some adjustments. So I think we'll see the impact of this at least through this fiscal year. Now, one of the big questions for us, and I'm sure for other localities, is all this, the money that's being, tossed out to address COVID issues. If there is some allowance of that funding to be used to offset revenue losses, then it may not be such a bad situation. If that money can't be used to offset some of the revenue losses, then it could be some issues where we have to take a look at reductions in expenditures and somehow try to match up the revenue and expenditure side. So for us, it's kind of a wait and see. But I think at least through this fiscal year, we're going to be dealing with the effects of this probably up until the time we actually work on the budget for the next fiscal year.
Yeah, Charles, I'll echo what Leon said. I was the guy that thought there's no way we'll have to cancel Rooster Walk because we'll be done with this thing by the end of May. And clearly that's not the case. I think it will impact us through the rest of the fiscal year, perhaps beyond. And as Leon said, with the CARES Act money, we are not allowed to use any of that money to replace lost revenue. And I know there's an effort on Capitol Hill as they try to work through this next stimulus package. And it is a bipartisan effort, if you get into the two chambers, to loosen that regulation and allow localities, both local and state governments, to use some of that money to replace lost revenue. I don't know whether that'll work out or not. I'm hopeful it does because we could use that flexibility. But, a lot of our budget, and as well as the city's budget, is driven by consumer confidence. Do you feel confident to go out and eat? Do you feel confident to go out and buy something? Do you feel confident to come from out of town here for a race or to visit your family? And we get meals tax, beverage tax, lodging tax based on the consumer's confidence in going out into public. And clearly that has been impacted and will be, I would think, for quite a while. So yes, we are going to be impacted by it for the foreseeable future. We went to basically a zero budget after all this came out in March, and just basically we're standing down on any significant expenses or expenditures. And we hope to be able to revisit that. But right now, I think this is a dark closet, and I'm not sure where the light switch is yet. So we're going to be dealing with this for a long time.
All right. My next question back to Leon is the Christmas parade. Of course, obviously it's something we put on. Obviously, we got to kind of look close at this and see if it's something we're going to be able to do this year, right?
Absolutely. Yeah, you might have heard my comment earlier about the special events, and right now we've suspended those permits. Somebody actually asked that question a few days ago if we were going to allow the Christmas parade. I'll be honest with you, we haven't even discussed that internally yet, and whether there's a way we can proceed with that in a manner. If we can do it and it can be done safely and in a manner that people feel comfortable both in participating and in watching, then we'll try to do that. But as of right now, we haven't made a decision on that, and I think we certainly will look at all the sides of that and try to come up with the best answer we can.
All right, last question for Tim. We've been running the mask campaign on TV, and it's gotten a lot of attention. The commercial that gets the most attention is the KISS, the mask commercial. And I understand that she might work with you, or can you just give us a little insight to that? Because that's the most popular one.
I will not call her by name, but yes, she does work in our building.
Right.
One of our longtime employees, outstanding employee, and she is a KISS fanatic.
Right.
And to the point where she has drum kits from KISS performances. She has makeup. She has outfits. She goes on KISS tours. She's gone on a KISS cruise.
Right.
So to see this employee at her day-to-day job, you would never have any idea that that's one of her things. But you know, I like golf. I know Leon likes golf. Leon was a runner at one point. Hers is that she likes KISS. So once we brought up the idea of employees participating, she asked me very gently and quietly, do you think it would be okay if I did it dressed up as KISS? And I kiddingly told her, if you don't do it as KISS, I'll fire you. I wanted her I wanted that out there to catch some attention. So she's an extraordinary employee. She's one of ours. I'm very proud of her. But yeah, that's one of our guys.
That's the one that's getting the most attention.
Hey, any attention we can get to putting a mask on your face, let's do it. You know, anything short of me dressing up as Gene Simmons, I'm willing to do. So.
Oh, come on, Tim, you can do it.
No, I sweat so
your
much
makeup.
that makeup would run to my toes by the time I got done.
All right, thank y'all for doing this.
Thank you so much. Do any of our speakers have anything else they would like to add?
I would just like to give you the information on the app. It's called COVID Wise, WISE, and it's available free for download in the App Store and in the Play Store. I sound like a commercial, but check it out.
Thank you guys all so very much, both speakers and media. I do feel like this is important to our community, and for you guys to continue to give your time each week. I do appreciate it. So thank you all very much.
Thank you guys. Appreciate it. Thanks for your time.
All right, everybody stay safe.
All right, folks, that wraps up our COVID update.